so often look at family members or paid team members as caregivers. And what that really implies is that I'm here to take care of you, and you don't have anything to give back to me, right? And that's very disempowering for people. It's very paternalistic. And so that concept of care partners, we are all in this together, family members, paid team members, volunteers, the people that work in the community. We're all in this together, and the elder themselves is part of that.
Hey y'all, this is Kosta, and today I'm here with my guest, Jill Vitale-Aussem, President and CEO of Christian Living Communities, a Colorado-based not-for-profit serving more than 1,000 older adults and families through its 9 owned and managed communities, including home care, spanning the entire state of Colorado. Jill is a licensed nursing home administrator, Leading Age Leadership Academy Fellow, Reframing Aging Facilitator, and author of Disrupting the Status Quo of Senior Living, a Mindshift. Today, we're talking about person-directed care and elder empowerment. So, Jill, before we get into the episode, I want to talk about your book, Disrupting the Status Quo of Senior Living. For anyone that isn't familiar, this book is based around the crisis we're facing in 2023 and the looming reality that we must evolve senior living. What can readers expect from this work?
Well, the book was actually published in 2019. And it's interesting at the time, I was concerned, is this too much to be saying that senior living needs to change? And what's happened, as we all know, is through the COVID pandemic, it's really shined the light on the fact that, yes, things do need to change. So it really, I think, is perfect for this time. A lot more people are talking about disrupting the status quo. So what people can expect is that, it's really a book about the evolution, I think, of senior living models. And what I've heard from people that they really like is it's a lot of stories about, I'll just say, the dumb things that I did before I knew better when I was a nursing home administrator and an executive director, right? And so it's really about, really changing our own mindsets and what we can accomplish when we start thinking about aging differently and when we start thinking about aging services in a different way. So I think people have found it very readable. And a lot of good examples. And then at the end of every chapter, there are discussion questions. So there are communities and organizations that are using it for book clubs. So it's really been fun to see it spark more change in our field.
And when you talk about the evolution of care, all right, so you're obviously a hands-on person. When I read that article that you had in AARP, it said that you actually became like a patient for 24 hours to try and see what it was like to be on the other side of things. When you talk about the evolution, why is that important to you?
Yeah, that when I first became a nursing home administrator, as my nephew always says, back in the 1900s, right? Like it was back in the time covered wagons. But when I first became a nursing home administrator, I had no idea what it was like to experience life as a resident in a nursing home. And so I had the team admit me as a resident, and it was an awesome community. It was like one of the best communities. But I really was very distressed by what my experience was, not because people weren't doing their jobs, but because they were doing their jobs according to the practices and the policies and the procedures that were in place. So waking me up every 2 hours to check my vitals. Being woken up in the middle of the night to have my skin checked, being woken up at like 5:30 in the morning for breakfast that was at 7. And I was so depressed when I left after 24 hours and just really wonky because I was
like overwhelmed.
Yeah. And I remember going home and just crying, like, this is what elders live with. And so that really sparked things for me. I'm kind of a weirdo. I've done that like 4 other times throughout my career, stayed overnight. And every time it's a huge eye opener. I really recommend it to anybody who works in this field to experience what life is like
Absolutely.
And it really just showed me that the institutional practices are what causes so much distress for people. It's not team members not doing their jobs or going rogue. It's people doing exactly what we tell them to do and ask them to do. So yeah, it was powerful.
We're going to get into the issues as to why the system is built this way, but first let's talk a little bit about the solutions that you've identified. One solution to the care crisis we face is something you've helped to pioneer and turn into a viable care option. Will you explain what person-directed care is and how does it differ from traditional care models in senior living communities?
Yeah, so the whole concept of person-centered care and now the evolution to person-directed care, it's been around for, at least 20 some years, right? Dr. Bill Thomas of the Eden Alternative was the pioneer, one of the pioneers in this work. And what the institutional framework does is it sees people as a task. It sees people as numbers. It sees people as a diagnosis. And it sees the people that work in our field as task doers, right?
Sure.
And
Right.
What happens is people end up, as the Eden Alternative says, being lonely and helpless and bored. And that is, when you go into a traditional nursing home or assisted living, and it also happens in places with residential living, and seeing people slumped over, the most of the time it's not their physical issues that are causing that. It's because it's like the death of the human spirit is really what it's about. And so what person-directed care is really all about is creating a human habitat, as the Eden Alternative says, creating a place where I'm a whole person, where I have autonomy in my life, right? I have as the Eden Alternative, it's the domains of well-being. So I have my own identity. I have a feeling of safety. I have meaningful growth still in my life. I have purpose in my life, connectedness with other people, and joy. Yes, right. You can have joy living in long-term care. And what Christian Living Communities, my organization, we take it a step further. And what we call our citizenship approach, which is really all about if I live in a community with other people, then I have not just what I need for me, but how do I make sure Kosta is having a great day? And it's people working together to make their community stronger and better. And that is incredibly powerful.
Well, and purpose, if you don't have a sense of purpose, or if you're not learning something new, at least, every few weeks or a month or so, like you don't really have, like you said, that will, right? Because life does get boring pretty quickly if you don't have those elements around.
It's very true. And if there's one thing that the pandemic taught us, it's what it's like to not have freedom, autonomy, meaningful purpose in our lives, not to have connectedness. Like we had this shared experience of what it's like to be institutionalized, and we hated it.
Oh yeah.
Did we not?
Yeah,
Did
we almost went to civil war over it.
Right. And so, if ever there was a lesson to be learned, it is through that. And I think we need to talk about it more and pick it apart more and figure out what we learned.
You've been doing this for a while. How did we get to this point? Because, if you go back to the 70s and 80s, and you had the Nursing Home Reform Act, and you had this increased level of compliance, was this always the way the system was designed? Did we create the system to operate this way? How did we get to this point?
So much. I think what I always hear and have read about is that nursing home design came from hospitals, right? And so this model of efficiency and the regulations like the OBRA 87 for nursing homes, that was really intended to create quality of life. What I think there's a couple problems. I think that we all have very ageist beliefs in our own heads, right? About what it means to be old, about what it means to be old and living with frailty and living with dementia. And we have very limiting beliefs, right? And we think in paternalistic beliefs, and our job is to keep you safe. And, if you're safe, then job well done. And that's not true. And so I think a lot of what happens is our own inaccurate beliefs about what this is really all about. And then the other thing is that regulations are going to create quality of life. If that was the case, then we get more regulations all the time, and it doesn't make anything better. So because I think what happens is a lot of times it ends up being check the box. I checked this box and I did this, and that means I'm meeting the regulations. Yeah. So it's a bear, this whole complex situation.
Well, and we're going to, I'll ask that same question in a different way later in the episode, but I think we can leave it in terms of when you talk about the evolution of the industry and the care process, I think that compliance leads to the opposite of that. The punitive measures, and also the fact that all of the people that pay for long-term care in one capacity or another are from the federal government or insurance companies. They're very risk averse, and they don't believe or understand the conversation that we're having right now, or they may just not really. It may not matter to them to the capacity that it does to us. But we're going to get into that a little bit later. Right now, I want to talk more about person-directed care. How can we ensure that the needs and details of specific care for each individual are respected and met in a person-directed care model?
Well, the first thing that really has to happen, and the Eden Alternative teaches this, is to drive change. You have to have three types of transformation happen. Right? And the very first is personal transformation. And so if we, as people that work in this field, don't change the way that we think about aging, if we don't challenge what all of the institutional things we've been taught and the ageist things we've been taught since we were toddlers, nothing's going to change, right? And so it's really about getting everybody in your organization, and this is whether it's residential living, assisted living, nursing homes, whatever it is, to go through this process of personal transformation. Leaders have to start first. And then when people go through that personal transformation, if you don't start changing your organizational side of things, right? And I've seen this happen way too many times where people get training and they're like, oh my gosh, this is the way things should be. Yet we still have human resources policies that are ridiculous. And we still have very limiting processes. Like if you don't get everybody up by 6 a.m, you're not doing your job, and things like that, then nothing will change. And so what I have found is that it's that personal transformation. It's people understanding that it can be different. It's changing your organization and your operational practices to support that. And, eventually the ideal situation is you change the physical environment also, right? And make it more, not home-like, home. And what happens is when you do that work, you're going to be held accountable by everybody. Right? If I'm like, and I've had this happen, I start doing something that's institutional, then I've got all these empowered people, residents, team members, family members who are like, what's going on here? This is institutional. And so it creates this environment where everybody's holding each other accountable. And it's tough, but it's good. But institutional practices creep back in. They're very sneaky. And so you got to have that shared accountability to keep moving things forward.
Well, and also we're talking about families and caregivers. What role do they play? And how do they change the way that they provide care in a person-directed model? And also, as you're going through this transition, what do you think they should prepare for?
Well, what I think this is really all about is creating community. Right? Yeah. In the community, that's why we call it a citizenship approach. You have meaningful purpose, you have autonomy, but you have interdependence with other people. And community is messy. And this work is messy. Like it isn't I'll tell you what, I think changing a nursing home or assisted living is like one of the hardest things you can do.
Mm-hmm.
Right. So for people
Absolutely.
to think we're going on this journey and all of a sudden it's going to be fixed tomorrow. That's not the case. It is step by step and moving things forward. So I think people have to be prepared for messiness.
Mm-hmm.
Right. And oops, that's not quite where we wanted to go. And how do we continue to evolve? The other thing is the concept of care partnership. And that's really important, right? Because we so often look at family members or paid team members as caregivers. And what that really implies is that I'm here to take care of you. And you don't have anything to give back to me. Right. And that's very disempowering for people. It's very paternalistic. And so that concept of care partners, we are all in this together, family members, paid team members, volunteers, the people that, work in the community. We're all in this together. And the elder themselves is part of that
The person receiving care. Yep. Agreed.
Right. So, and for family members, and, this is tough too, because, I know this as with having a parent, one who passed away a year ago, adult children can be paternalistic too.
Yeah.
Right. And so if a resident, an elder is making decisions that you don't agree with, and they're like, I know that I have diabetes, but I'm going to have my, coconut cake every night and with dinner. That's my choice. And
right.
it's that whole dignity of risk.
Right.
So there's change. Everybody on the care partner team has to have personal growth and start thinking about things differently.
And it's so sad. And honestly, it's quite alarming when you encounter family members who want to take away the things that bring people happiness. Like, for example, okay, I really like chocolate chip cookies. And even though I exercise every single day, I like to run, but I also like to eat chocolate chip cookies every single day, right? And Tate's specifically. So shout out to Tate's. If somebody said you can't eat chocolate chip cookies, or if they, like you were talking about in the pandemic, if they force some level of institutionalization, like that leads to depression.
Yep.
And it is, when I see this happening a lot of times is when people receive a dementia diagnosis.
Yeah.
And as it progresses, oh my gosh, we go down this rabbit hole, and it is impossible for people to give any ground to say, come on, like this is still a person, we can still provide care as if, to an individual.
Yep.
Right.
Yep. Yep.
But,
yeah, I think you're absolutely right. And I think 99% of the time it comes from love. I want to protect this person. But I think it's education and understanding that by taking away autonomy, you are impacting the person's physical health.
Yes.
Taking away purpose. So yeah, it's tough, but it's talking it through and having people think about things differently. But it's tough because we all love our loved ones, right? And
could you share some success stories or examples of how the person-directed care model has improved the quality of life for those receiving elder care?
Sure. I'm going to give you 3 different examples. Okay. Different levels of living. So, a really basic example is in like skilled nursing. And I hope this isn't still happening, but the whole idea of waking people up and the staff having a get up list, right?
It's crazy, right?
Get up list. Think about how that sets a person up for their day. Right?
Yeah.
I'm not going to, my day is going to be shot if somebody comes in and wakes me up when I don't want to be up. It also destroys our team members. Mm-hmm. Because, and I had a nurse tell me this, like it crushed my soul to be like, I have to go wake people up to do my job and get them out of bed and not at least let them start their day the way they want. So just even that basic change of promoting sleep and waking up when you want to wake up, and that has a huge impact. That's really basic. Unfortunately, I think it probably is still happening some places where people are.
Oh, it is. I'm sorry to inform you that it is still happening often.
Yeah, oof. That's
because, and what's unfortunate about it, and I hate to interrupt, but what's unfortunate is the checks that you're talking about and the medication administration that you're talking about are prescribed by physicians on a schedule. And I'm thinking, and I always think to myself, why would a physician think it's a good idea to wake somebody up at 2:00 in the morning to give a specific medication or to check a specific vital? And I mean, that's how pervasive this is. It spans across the entire healthcare system.
So we have to educate physicians to prescribe medications upon wakening, right? Rather than a certain time. So and they're part of the care partner team too, and need that education. An assisted living example, we have one of our communities that we manage has a beautiful pond, right? And it's in the mountains. And there is a resident there who loves fishing.
Nice.
And he's in a wheelchair. And the pond isn't like there's like a dock you can go out on. It's like reedy and marshy around the side of it. And this fishing brought this man so much joy. And in an institutional community, the team would have been like, he's not safe. That can't work. And instead, the team and the maintenance director, it's not really his job, right? Quality of life for residents officially, but it is his job because he's in a community that has done this work. They figured out how to get him one of those wheelchairs with the tracks on it.
Oh, nice. Yeah.
Right. And so he drives down there and sits in the weeds and marsh and fishes. And that would not happen. And that's one example of for one individual. But if he didn't have that, like he would give up. Like that brings him such joy. And so that's a example for one person, but it's that change of seeing somebody as a whole human being and not being so afraid of risk, figuring out how do we minimize risk to have somebody have a life worth living. The other example I'll give is in residential living. And we have several life plan communities, which have all the different levels of living. And this is really, so our community, Claremont Park here in the Denver area, I started here as the executive director there. And this is really about that citizenship model where the residents in that community own that community.
Yeah.
They have created an inclusive culture. So too many times in communities where there's different levels of care, if you live in the nursing home, you have dementia, right? You're cut off and you're ostracized. And they have created community norms there. And that's where the power comes in, right? Policies about bullying, I'm not so big on that. It's those residents there are true citizens, and they create healthy norms of inclusion for everybody there, and healthy norms of like, this is what we want to do, and we're going to make it happen. And the team there is just really there to support the life that the community wants, and people looking out for each other. And you just walk in that place, and you're like, something's different here. Yeah. Right. And we had Leading Age in Denver last year, the Leading Age annual meeting, and they chose it as one of their tour sites. And people that came to that tour, that visit to that community, leaders from around the country left. Like I saw so many people that were like crying. Yeah. They were like, this is the way it should be because the residents taught them about things. You know what I mean? So it's
absolutely. Shift. And if I could put a bow on it. So if you think about our entire lives, when we're in school, we're a part of a team. When we're at work, we're a part of a team. When we're in a family raising kids, we're a part of a team. The only time that we get isolated to this individual, angst is when we're elderly and suffer some type of disability and may have to be in an institution or a facility. And what you've been able to create is that team environment that is
Unity.
Yeah, exactly. It's common. I mean, it's literally how we grew up. It's, and it's rather shocking. But I do also want to touch on the individual that you had that goes fishing, and you guys identified that wheelchair that has a track on it. I'm a big proponent of technology. And we've just recently been working towards a pilot with United Healthcare to provide technology a few hours a day in some of our homes and remove some of the human element in the care process. Now, we don't have a weight care in a lot of the homes, so it's a good application in our model. What I have found to be astounding is when we accept technology as a solution, we actually find more solutions because we're open to the idea of technology. But we get so much pushback from the people, the people that pay for long-term care, not necessarily out of pocket, but insurance companies, managed care organizations, Medicaid, the primary payers, because they're risk averse. So in your opinion, how can technology be leveraged to support person-directed care and elder empowerment?
Well, when you think about risk, there's a lot more risk relying on human beings than technology.
Yes, agreed.
I mean, my gosh. My hope and the way we look at technology here is technology is never going to completely take the place of human beings in this field, I don't believe.
Right.
But technology that can free people up to be able to do what humans do best, which is be with each other and have those interactions. I think that's got to be the goal. And then the other thing I've been thinking a lot about is, and tell me what you think about this.
Sure.
How do we use technology to support autonomy and freedom for people living with dementia while keeping people safe?
Yeah.
Right. So, I love to walk and be outside. And if I have dementia someday and I'm in some place where I can't do that, or if I want to be in an inclusive place of care, right? Where I don't have to be locked up someplace. Right. And there's you think about your Ring, if you have a Ring doorbell, right? Like that's pretty cheap technology. And that can tell you that, Jill is at the front door and she just picked up a package. So can we use that technology? I think that's what you're getting at. Maybe not.
I am. And so I'm going to package it all together. So when you talk about specifically people with a dementia disability, you're never going to be able to remove the human element from the care process, and that's okay, because there are specific activities like going on walks that may require a human being to accompany or support somebody that has dementia. But if you can prevent the burnout that caregiver experiences, and even if it's a family member, the burnout that they experience as a caregiver, if you can provide some way of incorporating a few hours a day of respite. I mean, states are literally tripping over themselves with respite pilot programs. Florida, Tennessee, Colorado, like everybody's trying to figure out how are we going to provide respite to caregivers that are providing trillions of dollars a year in care for free, by the way. But the only solution that they look at is how are we going to create a workforce to provide these respite services? But we're past that. I mean, we're not living in the age of iRobot, obviously, but we have the technological applications to be able to give a few hours of respite to caregivers so that they can be there when it matters for those walks, right?
That makes sense.
And I'll take it in a different direction. As you can tell, I'm pretty passionate about technology. I'll take it in a different direction. Like somebody that, for example, is at risk of falling or has like an unsteady gait, if you just even put like some, like, those string lights that people use in the kitchen to have the lighting under their cabinets, if you put those on the floor and a sensor that's on their bed so that as soon as they get out of bed, those lights come on and light their way to the bathroom in the middle of the night. Like that's a simple DIY application that may cost under, $200 that a lot of people can afford. And what you're doing with regards to person-directed care and the evolution of care and creating citizenship, like technology is the direct complement to that.
It is. You're right.
So,
well,
long story short,
And you don't have to, if a sensor on your bed can say that somebody is in deep sleep, you don't need to go in and check on them, right? And turn on the light and make sure they're okay. And it really can. I think you're absolutely right.
And early, if you consider like early onset Alzheimer's before the disease has progressed to a significant point, like if your mom or your dad has early onset Alzheimer's and there are things that happen, but they don't happen often, but you're still like worried to death every single day that something bad is going to happen. If you had a sensor, say, for example, on a bed, and then they went to the restroom and then that sensor didn't show up, that they're back in bed. But if you had a sensor on the living room chair because it's 4:00 in the morning and they're watching TV, like that is how we have to start thinking about giving people back their dignity and their autonomy. So
I like that. That makes a lot of sense.
All right, so we're about to wrap up. In your opinion, what's the most necessary and impactful mindset shift we can make as Americans to ensure that our elder population is properly cared for and we build a future of care that is empowering for all people?
Well, so it's thinking about aging differently. And we have because when we think about aging as it's about decline and you become helpless, and it really impacts the services that we provide. It impacts, we don't value older people in this country. We do not value those that care for them. Right. It was evident during the pandemic when aging services was at the end of the line and then just got nothing but blame as compared to the hospital system. So if we don't start shifting the way we think about this field, who's going to want to work in the field, right?
Absolutely.
And we need people. As much technology as we have, we still need people. And then the other thing that is a big concern for me is this myth that is everywhere, that everybody can successfully age in place in their own home. We know that is not true. We know that the majority of people live in homes that aren't designed for changing mobility needs. We know people get isolated, which leads to incredible health challenges and problems. And we've got to start getting people thinking about it. So I have a book to recommend to your audience, and that is Ryan Frederick's book. It's called Right Place, Right Time. And it's really all about all of us, like at every age, looking at, does the place I live matters? And does the place that I live give me social connection? Does it give me opportunities for meaningful purpose, for physical well-being? And really looking at that, because I'm very concerned that we are setting up a huge percentage of older people and those of us, as we get older, for failure and worse health outcomes because they're going to be not living in the right place.
There is something that I was thinking about leading up to this episode that I was like, if she starts talking about this, I have to ask her this question. And so you did. So
yeah, it's concerning. It really is.
So think about it like this. You've got, the baby boomer generation between 1946 and 1964. We talk about this often on this show. So you have an 80% chance of needing long-term care at some point after the age of 75. The first baby boomer that was in 2021 turned 75. As the need continues to progress, right? Not everybody can age in place. But I read a statistic last week. We are short 6.5 million homes in the United States. How are we going to solve not only the aging problem, but also the housing problem? And do you think that this problem Is this like building the Transcontinental Railroad? Is that how insurmountable this problem is and how much effort and attention it needs?
I think we need to start looking at a growing number of older people not as a problem, but as a resource.
Absolutely.
Right.
Good call.
And when we start to shift that, it doesn't, there's so many opportunities as we get older that we can be part of the solution. And the more we're engaged, the more we live amongst other people, the less likely it is that we're going to need more higher levels of care, right? Because those things are definitely predictors of your health. So I think that needs to be a shift for sure.
Like a multi-generational adoption. So like more multi-generational families, essentially.
I don't know about that.
Okay.
I mean, potentially, but I don't know if we're ever going to go back to that.
Okay.
But I mean, just because we're older doesn't mean so think about, we've got a staffing crisis. We've got older people living, and I'm thinking residential living and assisted living, people who need meaningful purpose, people who can't afford senior living. And so we're doing a pilot at one of our communities with dining. Like if you live in this community, you want to make some extra bucks, we have these positions open. And why don't we do more of that? And if we stop disabling older people, maybe we don't need as many staff.
Absolutely.
And we can keep costs lower.
So we always like to end the show with a call to action. What advice do you have for families, caregivers, and senior living communities who want to adopt person-directed care?
Take the first step. Okay, go to a certified Eden Associate training, go to edenalt.org, sign up for a class. There's online training. Find books to read. Go to Pioneer Network and Greenhouse. They're another culture change transformation organization. There's a conference in July in Pittsburgh. Take the first step. I think it's really important you don't have to have everything all figured out, but start with that personal transformation and education on your own, and then keep it going. But take the first step.